onto YouTube right now so that people have that access as well. It says webinar is now streaming live on YouTube. So I guess we're all set to go. Welcome and thank you for joining us on this, the first virtual Livermore Town Hall. And we're here to provide an update from the city and our local healthcare providers on COVID-19. Reiterate the shelter in place. People should not go out unless it's for emergencies or to purchase food. When you do go out, wear the face coverings. We're keeping the N95 masks for our first responders and for the police and fire. So any face coverings. So for example, all of us came in today. We're all wearing our face coverings. And this is not to protect the wearer of the mask. It's to protect the people around the wearer. So if the wearer is coughing, it prevents any of the droplets from getting out. So it's not to protect the wearer, it's to protect people around the wearer. So we're looking out for everybody else. Our community is coming together as we always have. These are really unprecedented times. I'm very proud of the people and the businesses. We've got businesses now, for example, First Street Ale House and Hop Divine are becoming grocery stores. We have the Sutherland Distillery is taking their Zin gin mix and converting it into hand sanitizer. A lot of people have asked me, what can they do to help? Because at times like this, we're very good at handling emergencies and disasters because we can bring people together to solve the problem. Here, though, the problem is people. So we can't bring all the people together. So people still want to be able to help. So what they can do, you can contact Spectrum, Meals on Wheels, Open Heart Kitchen, Tri-Valley Haven. These still need your help. Seniors that can't get out still need your help. So they need drivers, they need donations. You can go to the city's website for a lot of the information on how to contact these organizations. I keep hearing from people, they need more information. They want more information. Go to the city website. There is a link for COVID-19 information. It's updated every single day. And this is where you can find the information that you need to stay safe. In the same vein with information, Mayor Halbert and I worked with the Alameda County Mayor's Conference to get the Alameda County Health Department to release the COVID-19 data for the cities. It was a piece of information that we heard from our community that they wanted. And, for example, Alameda County has 1,239 cases of COVID-19 that are confirmed. Livermore has 32. Pleasanton 47, Dublin 21. It's an important number for the county because the county tracks and traces those contacts. For the city, it's not that important because your behaviors should remain the same. Whether it's 10, whether it's 100, the behavior should remain the same. Don't go out unless it's necessary. Wear your face coverings. Wash your hands frequently, don't touch your face. Those behaviors must remain the same regardless of the numbers. So with that, to get you more information, I'd like to hand this off to our city manager, that's Marc Roberts. Marc, take it away.
All right. Good morning, Honorable Mayor. As you said, I'm your city manager, Marc Roberts, and wanted to tell folks a little bit about how we're doing as far as city operations. Although the doors on our facilities are locked, the city services remain open. So from that perspective, we want you to interact with us via phone, via email, by any of our processes that are not live. So we do have folks available to answer phones. We do have folks that are available to help you. Our firefighters, police officers, first responders are still on the job 24/7. Our water resources and our water services are out there. Our maintenance guys are making sure everything's taken care of. So your city folks are still here. We're partnering with other governmental entities, LARPD and the school district, to make sure that we're on the same page as far as information. We're working with LARPD to help some of our less or most vulnerable populations, our seniors, our unhoused neighbors, to make sure that their needs are taken care of. So those folks, and we're working with our nonprofits in the community as well to make sure that folks have meals, showers, that they're taken care of. So from that perspective, while your city offices aren't the same way as they normally are, we are on the job. The vast bulk of our employees are working remotely, taking care of business there, and except for those, of course, who are out there that you see on the street every day taking care of our needs. So with that, Honorable Mayor, I want to turn it back over to you, and you can start with our next panelists.
Okay, and just for the viewers at home or those that are sheltering in place, there will be an opportunity to ask questions after we hear from all of the speakers. We do have 3 other speakers with regards to healthcare and the shelter in place, but there will be an opportunity for many questions afterwards. So stay tuned after this. Our next presentation is from the Alameda County Director of Public Health. This is Kimi Watkins-Tartt, and she'll be providing an update from the Alameda County Public Health Department. Ms. Watkins-Tartt.
Good morning. So for the Public Health Department, the overarching goals of managing this response have not changed. Our goal is to reduce overall morbidity and mortality, prevent health inequities, and protect vulnerable populations. Also, it's our goal to protect our health system and to slow the COVID epidemic and reduce the peak number of cases, or you've heard people talking about flattening the curve. We have now put on our website a dashboard that we update daily. And so you can go to acphd.org and get the latest data for the county as well as for the city of Livermore. Each day we add more data elements, and so over time you will be able to see more and more data that answers a lot of the questions that you have. Per our health officer order issued on April 17th, starting April 22nd, everyone over the age of 12 must wear a face covering when conducting essential activities, including shopping at a store or waiting in line outside, using or waiting for public transportation, ride, share, taxi, seeking health care, or working at an essential job. People who don't have their mouth and nose covered will not be allowed to enter businesses or use shared transportation. Face coverings are not a substitute for staying at home, and we still want everyone to remain at least 6 feet away from others when you leave your home. And I want to remind you all that, and I believe the mayor touched on this already, that the covering is not a face mask, a surgical mask, or an N95 respirator mask. That's not what we're talking about. We're talking about cloth face covering. You can make it yourself, use a bandana, a scarf, and those are simple and easy to come by. We're seeing really good results from the shelter-in-place order, and we're evaluating regional and local data all the time to help us make decisions about our next steps. Our latest modeling for hospital surge planning indicates that if we continue physical distancing, our peak hospitalizations would occur sometime in late summer. Our disease containment effort really continues to be infection control in vulnerable settings, and we're employing a combination of testing and isolation and quarantining strategies to keep all of us safe. As we work to expand testing availability throughout Alameda County, I want to take a moment to really thank our city partners who are helping to meet this urgent need. We look forward to building on our countywide network with public, private, and community-based partnerships. Right now, on average, our testing is about 2,200 tests per week, and that was the data over the last month. Our goal for Alameda County, for a population of our size, we want to be able to do at least 2,500 tests per day for a population of our size. I also want to talk a little bit about this whole concept of contact tracing that many of you have been hearing a lot about, and many of you may not have known anything about. Contact tracing, or prior to COVID-19, contact tracing is an activity that we use in public health to monitor and to follow up on communicable disease. Over the past several weeks, we've scaled up our contact tracing team. Right now, we have over 60 people, and we anticipate training more people to meet the increased need as shelter-in-place orders are modified. Usually, pre-COVID, we had a team of around 6 or 7 people who conducted a case investigation and contact tracing for all of the communicable diseases that we monitor in Alameda County. So we've already ramped up that effort quite a bit. Depending on how the situation evolves, we'll need upwards of 300 people to lay a proper infrastructure for contact tracing. And we're looking at some really innovative models for contact tracing that will not require that individuals have public health experience, but who have really good interpersonal skills, who have the ability to connect with people by telephone and are engaging and are willing to work as part of our team. And so you'll be hearing more about those efforts down the road. Before I close, I just want to remind you of our key messages still are: reduce your exposure by staying at home unless it's essential. If you do leave, please cover your face with a cloth covering. And while we want everyone to shelter in place as much as possible, essential functions like access to care really do need to continue. We want to strongly encourage everyone to stay on top of pre-existing health conditions. Stay in touch with your healthcare provider. Those of us who have pre-existing health conditions, diabetes, asthma, hypertension, and so on and so forth, we really need to stay on top of our meds, stay on top of our healthy eating habits and exercise, and stay in contact with our physicians. Find ways to connect socially while you're sheltering in place. We know that this is a huge sacrifice that we've asked of everyone, and it has been difficult, and everyone has done a really, really good job, I have to say. But we don't want to become isolated socially, although we are separating ourselves physically. And we also want everyone to stay informed. There's so much information out there and it can be overwhelming, but please use all of the resources that we are all trying to make available to you to stay on top of information and to stay informed. Thank you.
Thank you very much, Ms. Watkins-Tartt. Certainly appreciate the information, especially the last part there where you were talking about maintaining your social connections, that we don't want to feel isolated. Call people on the phone. Right now, we're connecting with Zoom. My wife is taking art classes using Zoom and using Skype. So maintaining that connection is very important. Get out, take a walk. We're getting the beautiful weather now. If you see somebody on the trail, just step off 6 feet, allow the space. But one point that you made, I think is really, really important to underscore, is that it's not just about protecting people with wearing the face coverings. We're trying to protect the health system, because the system right now is at risk. As you were talking about the peak coming later in the year, we run the risk of overwhelming the healthcare system, because there are a limited number of beds and a limited number of staff. So we need to protect the people that are there, that are trying to protect us. That's the importance. So thank you for highlighting that.
You're welcome.
Next, I would like to bring up the CEO of Stanford Healthcare. This is Stanford Healthcare ValleyCare. That's Rick Shumway. And you'll probably be talking about some of the testing at the fairgrounds coming up. But I'd like to invite Rick Shumway, CEO of Stanford Healthcare ValleyCare. Mr. Shumway.
I appreciate it. Thank you for allowing me to join. I would be remiss in a forum like this if I didn't start off by telling you how much we appreciate the support that we feel from the community of Livermore, It's something that keeps us going. We've certainly felt it. And so thank you on behalf of the teams here at Stanford Healthcare, ValleyCare, and in the region. Also very glad that my colleague Marty is on the line as well. As you may know, or you may not know, this has been a very coordinated conversation across our region. And so Marty and I belong to a group that represents all of the East Bay hospitals. And we meet regularly and we have discussions with county officials, each other, to ensure that we're staying coordinated across a broad geography. So very glad that he's here as well, representing Kaiser, but also certainly the healthcare system at large. So just a few things as I thought about what I could share with you today related to some of the things you may have been hearing about or thinking about related to how does your local and regional health system respond to these kinds of issues. I will tell you that this is a singular moment. This has not happened since 1918, was the last large-scale pandemic that we've had similar to what we're experiencing. And so we're certainly building and growing as we go, but I'm tremendously proud of the people that are at the front lines doing this work, putting us in the very best position possible. I appreciate Kimi and the mayor talking about some of the modeling. We are certainly managing our internal models as well, looking at the doubling times, looking at the resources that we have in our control to make sure that we can handle various levels of surge planning within the community in the case that it's needed. The good news, as Kimi mentioned, is that in California, in the Bay Area, in Alameda County, we've been doing a great job, and the curves are starting to point in the right direction. We need to keep them going to that place, but I think that that's something that we want to continue to encourage and support in following the guidance of our government leaders and officials. Let me tell you a little bit about a few things going on at Stanford Healthcare ValleyCare that are really important for you to know. I want you to know that we are exceptionally well prepared for a surge. I can tell you that that is in large part due to the fact that we had time to plan. And that was in large part due to the fact that sheltering in place allowed us to do that in a meaningful way. So I want to share with you that we have what we colloquially call our 5-phase plan. And the California Hospital Association has actually asked all California hospitals to prepare to surge 40% beyond their top capacity. I'm very proud to say, could surge up to 70% beyond our top capacity here at Stanford Healthcare ValleyCare. That's because of a number of things. We have spent significant time, energy, and resources building out our isolation capability, our negative pressure capability. We went from having 7 capable rooms that could take care of ICU level negative pressure isolation patients, which many hospitalized COVID patients are. We went from 7 rooms to 54 in 3 weeks. It was just an exceptional effort. Our ventilator fleet is in really good shape. We continue to manage and monitor that, but we believe that we have a good fleet of ventilators to be able to take care of patients in a surge. And while we continue to watch very closely and manage and monitor it every single day, I'm very proud of our supply chain teams that have ensured that our staff and our physicians have enough PPE and are able to use it as it's intended to be used. So we're actually in relatively good shape from a PPE perspective. Another preparedness item that I think is unique to us is that we are, as part of Stanford Medicine, one of 54 sites in the world that is enrolled in an NIH clinical trial that's intended to assess treatments that are novel for coronavirus and for COVID-19 patients. We are one of 10 in California. And again, I think this is one of the benefits of having Stanford Healthcare in the community, is being at sort of that bleeding edge of clinical trial activity and development of new clinical protocols. And so you can actually expect in your community that you have access to those kinds of resources. One of the other things that I would share as a message, and I think Marty would agree, and I hope he'll support me on this, is that hospitals are safe places to come to get care. Arguably, we would make the case that they're safer than many other places in the community right now. That's the result of a number of things. At Stanford Healthcare ValleyCare, we have a no visitor policy. While that's a challenge and a departure from our historical operating procedures, it's certainly important from an infection control standpoint. We mask all of our staff and all of our patients that come into our organization. We have a sufficient supply of PPE that we're able to, again, let our people use as it is intended to be used. We do daily staff and physician screening upon entry into the hospital, including temperature screening and other symptom tracking. We also have launched COVID-19 testing for all of our staff and providers, including the serology antibody test for all Stanford Healthcare ValleyCare individuals, which is a really, really big deal, as well as testing many of our patients that are coming in for procedures and otherwise. Essentially, these measures ensure that the hospital is actually a safe place to be. It's a safe place to come and receive care, again, probably safer than many places elsewhere in the community. So my plea to you is to come get healthcare when you need it. I won't share too many anecdotes, but I will tell you that we are seeing some unanticipated negative effects of COVID-19 in the sense that people are delaying access to healthcare that is really needed, that should be taken care of, and are not coming in because of a perception that the hospital is not a safe place to be. So I'm asking you to please rethink that mindset. If you have an issue, please come and seek care. There's a reason that the wisdom of our public health officials indicated in the orders that healthcare operations are exempt from the shelter-in-place order. So we want to encourage you to take advantage of that when you need it. That's very, very important. Just a word about testing, and then I'll be done and pass it back over to the mayor. One of the things that I'm very proud of is that Stanford has been at the very forefront of the development of testing capabilities, assays, and otherwise. We have, since the very beginning of this outbreak, been able to access rapid turnaround tests at Stanford in Palo Alto for our samples. Many other providers are sometimes waiting days to receive the results. We have received in less than 24 hours these results since almost the inception of this outbreak. Even better news is that at Stanford Healthcare ValleyCare, we've also acquired rapid turnaround testing capabilities in-house. We have the 45-minute testing, the Cepheid units that we're able to provide as needed through our patient population. And again, we are one of the few organizations that is performing the serology antibody tests that detects whether one has had the virus. There's still a lot of question about what do you do with that information. As we learn more about the virus as it goes forward, we need to make sure that we're using that information appropriately. But that is a test that is available for all of our physicians in the Stanford Medicine Network to order and to utilize. In addition, as I mentioned, all staff and physicians are being tested with that serology test as well as the PCR nasal swab. Last thing that I'll mention about testing is that we have had a number of testing sites that have been available over the course of the last few months. We stood up a drive-through testing site here at the hospital, as well as one at 5725 West Las Positas, which is the cancer center parking lot. Both of those require a physician's order, ensuring that whoever is getting tested really is symptomatic and has a number of pre-existing conditions that would require a test. But what I'm really excited about is starting on Monday, in partnership with the City of Livermore, City of Dublin, and the City of Pleasanton, we have been able to come together to develop a new testing site at the Alameda County Fairgrounds. There is no physician order necessary or appointment required, and the testing criteria have been broadened at that testing site. It doesn't mean that everybody who thinks they might want to have a test would be appropriate for that, but I will share with you that if you have one of the following things, you would be considered for testing at this site. So if you have a fever of over 100 degrees, if you have shortness of breath or other respiratory symptoms, if you have a recent exposure to a confirmed or suspected coronavirus patient, if you have a chronic disease or condition, if you have blood disorders, liver disease, diabetes, heart issues, lung disease, compromised immune system, if that's the only qualification that you have for testing, we will test you. We will test anybody over the age of 65. We will test anybody who is currently or recently pregnant. We will test anybody who falls into the category of being homeless. And primarily this site is intended for the residents of the communities of Livermore, Pleasanton, and Dublin. But we're continuing to look for ways to, as Kimi said at the beginning, expand the testing capabilities of our county. And we're very honored to be able to be a part of this. So that starts Monday at 9 to 5. I will put the qualifier out that I sound like a TV advertisement, but while supplies last, we will manage the testing kits that we have access to. And if we run out on a certain day, we might close a little early and then reopen the next day. But we're constantly looking for additional testing resources. So with that, I'll pause and turn it back over to the mayor, and happy to answer any questions at the end.
Okay, we've got a few questions that are coming in, but I'd like to get through all of the panelists first because some of those questions may be answered in the course of the program. Thank you very much. I certainly appreciate your comments, Rick. It's heartening to hear about that the hospitals really are safe places to be. I think one of the most unsafe places that I've read about recently is the gas station, and the gas pumps are a good place to catch diseases. So let me get on to our next speaker. In a second here. There we go. This is an update from Kaiser Permanente, Marty Ardron. He's the Diabetes Service Area Senior Vice President. So Marty, thank you for being part of the program today.
Thank you. Appreciate it, Mayor Marchand. I promoted you to doctor. Wanted to thank you for convening this town hall. It's really essential we disseminate updated and important information. Also wanted to thank the other presenters this morning providing the update. It's important that that we're able to work together, and thanks, Rick, for indicating that the hospital council is directly engaged in coordinating with county health to make sure we have a coordinated response to this work. We are safely and effectively treating many patients infected with COVID-19 throughout Kaiser Permanente. Staff at our medical centers follow public health guidance to be used while addressing the coronavirus. As more has been learned about the virus, our policies and procedures have evolved to maintain patient and staff safety while providing excellent care. At the same time, we're actively preparing our facilities and team for the possibility of a surge of COVID-19 cases. We've shifted most outpatient visits to virtual care appointments and are emphasizing mail order pharmacy services. We've delayed elective surgeries to allow capacity for managing this crisis. In fact, more than 80% of our visits statewide and system-wide are now phone and video visits with a clinician, and mail order prescription usage has nearly doubled. We are encouraging Kaiser Permanente members or their family members who have symptoms of respiratory illness to call the number for the 24-hour health advice on the back of their Kaiser Permanente membership card. Cost should not be a barrier for care. Kaiser Permanente will not charge members cost sharing, including but not limited to co-pays, deductibles, and co-insurance for all medical necessary screening and testing for COVID-19. We continue to operate command centers established in February and are regularly assessing our hospital census, available bed staffing, material, and equipment. I want to thank our community members for their support in these times. We've received an outpouring of appreciation for our staff and community members, and business leaders in the Livermore Valley have stepped up to help donate and procure personal protective equipment. Our goal is to ensure that we have adequate access to PPE and medical supplies needed for the screening and treatment of COVID-19 patients now and over the long run. With the support of our supply teams and our staff, we have increased our supply of personal protective equipment and in particular masks, and we're in pretty good shape. Kaiser Permanente is running COVID test results in our own clinical laboratories to augment overall testing capacity in Northern California. The results of tests done internally are available in 24 hours or less, generally less. We're also pleased to be participating on Governor Gavin Newsom's COVID-19 testing task force, and we know this will help boost our capacity. It's critical to build our ability and supplies to meet the statewide testing needs. I want to commend the hard work of our first responders and frontline workers in our hospitals and throughout our communities for their dedication. And I want to thank the people of Livermore and the broader Bay Area for staying home, washing their hands, and doing their part to flatten the curve and allow us to begin to take the small steps necessary to move forward. And I would also just like to mention that that it's very heartening to see the community and the cooperation with public health entities, with city leaders and local and community leaders as we all work together to get through this. And I'm certainly available for any questions, and I'll turn it back to you, Mayor.
Okay, Marty, thank you so much. And thank you all for the great information we've had today. Some of the real takeaways that I got were that the protecting the healthcare system, I think that's something that not many people think about. You think of our first responders, the police and fire, that they're always going to be there. And I think we all feel, well, the hospital is always going to be there. You know, you walk in, you need care, you're going to get it. That this is really, as all of you pointed out, unprecedented. That this is about protecting the healthcare system so that it continues to have the resources that we need so that it itself isn't compromised when we do have these unprecedented surges. The face coverings are to protect the wearer, not to protect the wearer, they're to protect everybody else around them. And I think that's what a lot of people are missing is that, well, some people feel that they're not worried about putting themselves at risk, but we need to focus on looking out for other people and not putting them at risk. We heard from Ms. Watkins-Tartt about some of the numbers and the importance of the tracking and tracing of these infections. But for the cities and for our own individual selves, that's not really important. The numbers aren't important because our behaviors should remain the same. Wash your hands, shelter in place, avoid unnecessary travel. Look out for your neighbors, look out for the other folks around there. Volunteer with Meals on Wheels to make sure that our seniors are not isolated and that they continue to get nutritious meals. So with that, I do have some questions. Kimi, Watkins-Tartt from the Alameda County Public Health. Would it be possible to begin opening playgrounds with a play at your own risk sign? Wow. Ask families to continue distancing. Wash your hands before and after playing. Wipe down surfaces such as swing chains and slides or wherever children touch. Keep children at home that are immunocompromised or have family that are. Opening playgrounds with a play at your own risk sign.
So,
what are your thoughts on that?
Our county health officers are, and I say plural because as you know, we participated in the sheltering in place order with 6 other health jurisdictions in the Bay Area, and they are in conversations daily about what our next steps are going to be. As we all know, our society will slowly open back up. We are not yet at the point where playgrounds are open back up. And so, yeah, we're not there yet, but as soon as that time comes, we will make sure that we have the proper provisions in place and work and partner with cities to ensure that children can play safely, but it's not that time yet. And we know that everyone, with the weather getting, beautiful, it's beautiful right now, that we all want to be outside and we all want to play, and we know that our kids want to play, but it's not that time yet. Sorry.
Well, that's okay. Thank you. This is another good question. Have you considered allowing dentists to test for COVID-19? They are allowed under Governor Newsom's orders to operate, and if provided with testing materials and PPE, they could be allowed to do so before normal appointments, and they would be able to test the vast majority of the population within 6 months or less.
I'm not the best person to answer that question in terms of there is training necessary to perform the test itself. I do think that a dental practice might be, especially if it's a large practice or serves a certain population that is particularly vulnerable, they might be a good place for a partnership where testing could occur. But I'm not sure whether or not they themselves would be able to perform that test. But I would definitely say that partnerships are always encouraged.
Yeah, great. Well, you can take that question to some of the other public health officers. So that's all the questions I got for you right now. We're going to go down the line here. Question for Mark Roberts. For those businesses who have been able to remain open, is it required to provide a public restroom for customers to use?
So the rules on public restrooms haven't changed with the COVID-19 crisis. So if the business was required to have a restroom beforehand, for example, almost all establishments that have some sort of eating, but of course, since dine-in isn't allowed anymore, those facilities are sort of not available. Certain types of retail businesses are required to have restrooms as well, depending on their size, scale, and what they sell. And so those rules are just the same as they were beforehand. So if they were required to have a restroom beforehand, they're still required to have a restroom.
Okay, thank you. Okay, this can be for, okay, I guess this is for Rick at Stanford ValleyCare, Stanford Healthcare. How long do you anticipate that the testing center will remain open?
Great question. So the original proposal for this is a 4-week opportunity that we have at this point. As is the case, and I think you see this in the news regularly, is the length of time that it'll be open will be contingent upon the resources that we're able to obtain. So fortunately, through our Stanford Healthcare channels, we've been able to identify test kits. We've also, and those are the kits that will be used at the site. We have made requests through the county and through the state for additional test kit availability. And so the length of time that it will be open will really be contingent upon what resources like test kits that we're able to continue to get access to.
Okay, and thank you. There was somebody had tuned in a little bit late. So rapid questions here. Is there a screening of symptoms to get tested? And what would be the cost? So you had mentioned the screening, the pre-screening ahead of time.
Yeah.
So you go over those points.
Yeah, so I'll do that quickly. So the screening criteria for this site is a little broader than the standard drive-through sites that we operate right now and that really are operational across the region. The big differences are things like you can be an asymptomatic person and not have symptoms, but you might have diabetes or other chronic health conditions. You may be over the age of 65. You may be pregnant or have been recently pregnant, homeless. Those are other categories that we would be able to test without showing symptoms, in addition to people that are actually have symptoms that are presenting. So those are sort of the criteria. From a cost standpoint, it's variable. There are two things I'll say though, similar to what Marty mentioned. There's actually been a federal government rule that the patient burden for COVID-related healthcare actually doesn't really exist like it would have previously. So what would happen is if you have an insurance plan, we would work directly with your insurance plan on reimbursement for that, but you would not see any out-of-pocket costs or collections on your part. And so I think that's an important distinction to make.
So there's no co-pays, there's no out-of-pocket expenses. People can come up and get tested. If they know that they've been exposed with a suspected exposure, if they have pre-existing conditions, if they're over 65, come on in. If there is a realistic possibility that you may have been exposed or you may be a carrier,
yep,
that come in and get tested.
Because
we've learned that a lot of the infections have been spread by people who are asymptomatic. That are not just symptoms.
And I think the other distinction about this site is if you have questions and you want to come through, we actually have a provider there on site that will be talking with you. And so that's something that will help sort of distinguish some of those testing criteria. So that's sort of the general guidelines, but we'll have a physician or a nurse practitioner on site to be able to go through those questions as well.
So a few pre-screening things, but far more open. The question: do you have enough testing kits to meet the expected demand? We sure hope so.
I think it's an interesting question. I don't know that we know what the demand is at this point. I think we're going to see on Monday, and we're going to adjust as necessary. Like I say, we do have an expected number of tests per week. I will share with you that we are shooting to do 750 tests every week at this testing site. If we get more kits and more availability, we will do more. But that's the number that we have access to for that 4-week time period starting on Monday. And again, pending access to additional supplies, we can expand or contract or whatever we need to do based on the demand that we're seeing. But right now it'll be open from 9 to 5. And so feel free to drive up. There is a walk-up option, but if you've been to the fairgrounds, it's through entrance 12. It's a long walk. So you're welcome to do that, but we would encourage you to do that in your car.
That was one of the questions about whether there's a walk-up option. And
Right.
You're saying that there is, but it's a long walk.
Yep.
And we don't anticipate wait times. We don't know. That was one of the experiences in Hayward, is they were expecting this huge, and the first couple of days, there was a huge bunch of folks. But at the same time, once they realized there was a little bit of pre-screening, I think the initial concern is people are there's a panic, but once they realize that this is available and that the real reasons behind it are to start getting a sense of how widespread it is, so we can start the tracking and the tracing to be able to continue to protect the healthcare system. We don't know the anticipated wait times, so we don't know how many people are going to be there. You did mention that Stanford Healthcare ValleyCare is doing antibody testing. Where would somebody go if they wanted to get, if they believed that they already had it, and to get antibodies?
So currently there is not a testing site for the serology test. So that's being administered through the hospital. So if you're here, that would be something that your physician would order for you and that we would administer through that mechanism. So if it's something that you feel like you need to be considered for, you can certainly reach out to your primary care physician, who would then make a determination on whether to submit that order for that test. As I mentioned, this is not a broad scale test at this point in time. And again, and I would actually defer to Kimi, who I'm sure fields this question every day, all day. But the reality is there's still so much that we don't know about COVID-19. So that if you get a test that says, okay, looks like you have some antibodies, that doesn't mean that you could never get it again per se. It doesn't necessarily mean that you're not a transmitter. It doesn't mean a lot of things that we just don't know yet. So it's not quite yet the silver bullet to fix the problem. It's a huge step in the right direction. It helps our clinicians in making certain decisions, and certainly helps keep our staff and our patients that are in the environment safe to the degree that we can extend that to them. But at this point, it's not a broadly available, public test that you would get in a drive-through testing site. And so I defer to Kimi as well on sort of her thoughts on the long-term utility of this.
I would say in terms of in general, that we are hoping that over time we will, have more and more and broader availability of testing. We'll also know more about the efficacy of the different types of testing, the antibody testing, as well as other things that are coming online. And so I would just underscore what you're saying, Richard, is that we don't know a lot. And so we are using the best information that we have available to us at the moment. And so it does help us. The tests do help us to plan resources and plan how we target our interventions and where to target interventions, but nothing is perfect.
And so I've got you on the screen here, Kimi. Question here, as we begin to open up our county, what would be the first types of non-essential businesses to open?
Yeah, I'm not sure what those will be.
Our favorite restaurants.
Yeah, I'm not really sure what those will be. Our county health officers are going to be advising us around which businesses or how to phase back in. And so it may not necessarily be a particular category of business. It may be, okay, if you're able to do this, and do this, then opening back up. But we will hear something from them soon. And so, yeah, no decision has been made in that area yet.
Yeah, well, as the governor said, it's going to be more like a dimmer switch than a light switch. Everything's not going to come on all at once. We have no idea, as you pointed out, we have no idea when the shelter in place is going to be lifted. It's just going to be a decision that's going to be arrived at by the 6 or by the 7 public health officers for the 6 counties.
Yes.
Question for Rick and Marty. If you test positive, but don't present symptoms, what do you do? My sense would be stay at home, because we know that people that are asymptomatic are the primary folks that spread the disease. Is that correct?
Yeah, this is Marty. I can start, and then certainly Rick can chime in. One of the reasons why we have folks call the member services line and not just show up at their doctor's office or show up at the emergency department is we want to provide for them the best opportunity for them to get the appropriate care in the appropriate care setting. We have the ability to safely test them, but decrease the risk of exposure of other people, minimize extra use of PPE that's not necessary. So we will direct them to the appropriate setting to allow them to get their care met, and including testing if appropriate. And in that situation, depending on what care needs that they have, it may be the most appropriate thing for them to go and stay at home, protect themselves and others, and continue to be engaged with their primary care physician to direct any other needs, whether they be for other care needs or pharmaceuticals or things of that nature. So we would want them to call the member services line and get to the appropriate care setting for the appropriate treatment. And in that case, unsymptomatic with no other significant symptoms may be the best thing for them to work through that illness at home. And again, stay in close contact. We'd also be providing them guidance on when it would be appropriate for them to, maybe be retested and potentially come out of that more restricted contact with family members in the home setting. But again, with the stay-at-home order in place and the restrictions around social distancing, that's an overall precautionary measure that is protective broadly.
Yeah, I would concur with 100% with what Marty said. The only addition I would make is keep in mind that 85% of individuals that have COVID-19 as a diagnosis are either asymptomatic or do not require hospitalization. So the best course of action for those individuals is to stay at home. And so again, I think it's, to Marty's point, getting in touch with whoever your primary care provider is to work through kind of what do you watch for and how do you handle this is the best course of action. No need to come in to the hospital unless there's an urgent or an emergent or acute issue that you need dealt with, but work through your primary care physician. The likelihood that you need to come in for acute response is pretty low.
Thank you. So Marty, question for you. Which is your favorite child? The question is, between Kaiser Walnut Creek or Kaiser Antioch, is one in a better position to handle COVID-19 cases?
Well, that's a great question, and we have the two medical centers as well as many other campuses throughout the Diablo service area. So I have a group of favorite children, and I try to spend as much time as I can on all of our campuses. I would say that both are well equipped for managing the COVID crisis. Similarly, as Rick mentioned, we've expanded our ICU and our med-surg and our capacity. If you drive by either campus, Walnut Creek or Antioch, you'll see interesting looking tents out front that we've put in place for the event that we would have to expand capacity even into external venues, and that's precautionary, and we've done a lot of planning around that. I would say that we're well equipped in both instances to meet the need, and I'd have to say that it's a tie between both of them. I don't have a favorite campus. I would say the Walnut Creek campus is interesting, in its location, kind of very close, tucked into the downtown area here in Walnut Creek. The Antioch campus is a little bit more rural, and so it's just a completely different setting and feels like two very different campuses, but providing excellent care in both places.
Great, thank you very much. All right, so I'm looking at the questions. There's somebody asked about the opening up of construction sites, operations, and I think that Ms. Watkins-Tartt answered that one, that it's just going to be gradually opened up, similar to a dimmer switch rather than a light switch. There's a couple questions for me. From your point of view, what are the current needs in our community, and how can Livermore residents help to meet those needs? Let's start by saying that I spend a lot of time on Nextdoor, not as much on Facebook, but what particularly moves me is the number of people out there that are posting on Nextdoor that they're out there to help their neighbors, that they're looking for people, that asking how their neighbors are doing, looking after the elderly people in their communities, volunteering to go shopping for them, volunteering to share supplies when things like hand sanitizer and toilet paper were in short supply. People that were offering to share that, to give that to their neighbors. You can go onto the city website and get more information about Spectrum Meals on Wheels. There are seniors out there that have had a difficult time getting out, even more so now during the shelter in place. Go to Meals on Wheels, help out delivering those meals. They have new protocols in place to ensure the safety of both the people, the seniors that are sheltered in place at home, and also protocols to protect the drivers. The drivers all wear their own PPE, and they just make sure that they're healthy. Volunteer to help out with Open Heart Kitchen or Tri-Valley Haven. So these are opportunities to help out. You can go onto the city website and find more information, contact information for all of those. And this is what Livermore is. Livermore was known for his kindness and generosity, and that continues to live on in the DNA of our community. So continue looking out after your neighbors, looking after everybody else. That's why we're wearing the face coverings. It's not for the people that are wearing the face coverings. It's for the people around them so that they don't get infected. And again, to point out that to make sure that the healthcare system does not get overwhelmed. Another one, when are the kids going back to school? Well, according to the Livermore Valley Joint Unified School District website, school is dismissed through the end of the academic year, which is June 4th, 2020. The city is going to continue to coordinate with the school district to keep families informed as to the progress. Of course, the school district is a separate elected board, a separate agency, but we work very closely with the school district and the park district. We have a separate park district as well. Get out there, enjoy the trails. Again, just maintain safe social distancing. Don't clump together. Anything that involves sharing equipment like basketball, baseball, tennis, those sorts of things. We can't do that right now because you're sharing contact. We'll eventually be able to get back to that. But until then, enjoy the great outdoors, get out there and walk, enjoy the community, do takeout, keep our businesses alive, do takeout, buy gift cards. Very important to keep our businesses alive. So when this is all done, we can go back out and start gradually easing back into our lives. Just a question popped up. Is Kaiser offering COVID-19 testing, or is that simply through the current healthcare providers? I think this question is there a remote test site, or is that COVID-19 testing being done through the healthcare providers? Marty.
We have several locations across the Diablo service area for remote testing, drive-through testing, testing in the outpatient environment. We obviously test in the hospital environment as well. And the member services call center will direct folks to the most convenient location for testing.
Okay, very good. And as far as donations of PPE to Stanford ValleyCare, Stanford Healthcare ValleyCare, or Kaiser, again, this is an amazing community, and they want to help out. They want to donate. I know of folks that that do have access to PPE. So as far as donating to Stanford Healthcare ValleyCare or Kaiser, how would people go about doing that?
So we're
people that are looking after our healthcare providers.
Yeah, we're very grateful for that. And in fact, for the last number of weeks and almost 2 months now, we've been operating the donation center out of the Lifestyle RX facility in Livermore. And we've actually been very grateful for those donations. At this point, what we're hopeful of is that many of the supply chain strategies that we've put into place really allow us to alleviate the need for large-scale donations, and we're able to access those things through the supply chains. So at this point, we've actually suspended our donation site at this point. However, if you are interested in donating in any other way, we've had people that want to donate food to our staff, and some people want to donate funds to support the COVID COVID-19 recovery efforts, you can always access the ValleyCare Charitable Foundation, who is managing sort of a broad scale response to that, and you can find them online. There's a link on our website, valleycare.com, and you can go there and see different ways to do that.
Okay, so they can donate to the foundation.
That's the
I'm
best
sure
way right now. Yep.
I'm sure that Kaiser has a similar foundation after those.
We do, and we are still accepting donations and are grateful for donations. Folks are bringing them to Walnut Creek Medical Center or Antioch Medical Center. We're accepting them in the main entry way. It's easy to find our main entryway now in each of our campuses because we've restricted it up to only one entrance. So we're able to accept donations, small donations, at those locations. Larger donations we can certainly coordinate, and that information can be accessed on our website.
Thank you very much. Well, thank you for all your participation today. Lots of great information. Again, shelter in place, wash your hands frequently, don't touch your face. We've got an economic development and small business assistance town hall coming up at 1 o'clock. So Vice Mayor Bob Warner will be hosting that. So stay, come back for that one. Lots of more good information on keeping our businesses alive. But I'm incredibly gratified at the great work that all of you are doing. Thank you so much. Be safe, stay well, and we'll see you on the other side of this crisis. Thank you all.
Thank you.